Good morning, everyone. I'm happy to be with you today. I'm Abir Aldhalimi, and I'm the Senior Inclusive Development Advisor in USAID's Inclusive Development Hub in Washington, D.C. I've had the pleasure of working with our mission in Colombia on mental health and inclusive development programming for a few years now. I'm a clinical psychologist by training, and prior to my current role, I served as the Senior Mental Health Advisor in the agency's Inclusive Development Hub. USAID and USAID Colombia in particular have made concerted efforts to advance mental health and psychosocial support and programming, especially for marginalized communities. Mental health implications are woven into all layers of international development. The uptick in poverty, displacement due to armed conflict, political violence, and war impact every aspect of an individual's life, their family, and community. Any individual's mental health will be impacted by these events, despite how resilient they may be. Some will go on and be okay, and others, however, may develop mental health symptoms and conditions. Unfortunately, for those individuals in low and middle income countries, they will not receive adequate care due to scarcity of resources, services, or stigma against mental health and mental health care. Poor mental health will have direct implications on an individual's overall well-being, their community, and the country's economic stability. USAID recognizes the importance of mental health, and our missions, including here in Colombia, have designed innovative approaches to integrate mental health into our activities for victims of torture and conflict. For over 20 years, the USAID has worked to support victims of torture and conflict through our Victims of Torture Fund, by positioning our programming to help improve access to and quality of mental health services, invest in mental health and psychosocial support workforce, strengthen mental health systems in a country, and fund research to advance interventions. The elevation of mental health and psychosocial support in Washington, D.C. is also related to standing up of the Inclusive Development Hub. The Victims of Torture Fund is one of the 9 portfolios at the Hub. The Hub provides technical assistance to the rest of USAID to promote inclusive development as an overarching development approach. The Hub brings together a set of technical areas that focus on rights and improvements to the safety, well-being, and inclusion of marginalized and underrepresented populations in development efforts, and to ensure continued overall attention to issues affecting marginalized populations. Inclusive development, as defined, is an equitable development approach built on the understanding that every individual and community of all diverse identities and experiences are instrumental in the transformation of their own societies. Their engagement throughout the development process leads to better outcomes. In practice, this means working in tandem with our mission colleagues. Part of our efforts to improve access to rights, safety, well-being, and inclusion of marginalized and underrepresented populations is to also recognize and address their mental health needs. These groups are more likely to experience discrimination, violence, and prejudice, which have direct impact on mental health. Even without these life-altering events, being a minority, whether non-dominant or statistically in a country, is linked to chronic stress. An added layer of complexity is that marginalized groups may manifest their mental health symptoms in unique ways due to cultural or linguistic background and related to prolonged exposure of trauma and the strategies they may utilize to help navigate the everyday realities. Eventually, we can't fully address exclusion and meet our development objectives without examining and addressing mental health in marginalized groups. My work in Colombia has inspired me to not only address mental health for marginalized groups, but also to take a culturally pertinent, multi-layered approach when designing programs, including through policy, the health sector, and civil society organizations. Globally, mental health services are under-resourced, I'm sure you're aware of that, and are often neglected in the global public health space. The implications of marginalized groups is the direct impact of their health, well-being, and poor system-level initiatives to meet their needs. So, what does this look like in practice? To advance mental health through the lens of inclusive development. First, I think with these realities in mind, it's important and an imperative to ensure mental health access is available for these groups, especially those who have endured human rights violations, political violence, or trauma. That should be our number one goal. Today, there remains barriers to care, especially for marginalized groups, including lack of insurance coverage, lack of parity in insurance coverage, for instance, being insured in a government-sponsored insurance versus private-sponsored insurance, and stigma and language or cultural barriers. And lastly, distrust in providers and distrust in the health system by some marginalized groups. International development, especially when using an inclusive development approach, requires us to have a better understanding of the contextual factors before proceeding to designing and implementing of programming. An inclusive development approach needs to uphold USAID's principles of do no harm and do nothing about us without us. What does that mean, right? In practice, this means we assess the definitions of mental health according to local context and challenge our Western biomedical model for understanding and treating mental health conditions. This rings especially true for Colombia's indigenous groups and other racial and ethnic minorities. Providing mental health care for those impacted by conflict and those from marginalized communities should be done in partnership with other social, cultural, and family supports, when appropriate, of course. Finally, we need to challenge the notion of the right approach for mental health and mental health care. This includes challenging our own implicit and explicit biases and addressing policies and systems to ensure the equitable treatment of these individuals. When it comes to us and our design teams, we need to challenge who's at the table. We need to ask ourselves who's not being represented at the table, and we need to proactively invite members from groups to guide our understanding of their own priorities. This engagement and partnership should be during the life of an activity to ensure that we strive and we have meaningful partnerships. A subset of those who have mental health needs will identify as being members of the disability community. Ensuring the use of a disability lens to help guide our programming is imperative. This means mainstreaming the inclusion of this group in all development programs at all stages, from planning to implementation and finally monitoring and evaluation. Investing in capacity development for mental health providers, including identifying a path to professionalization for mental health providers from marginalized communities, will help invest in mental health workforce in a country, as well as challenge the mistrust of health providers from groups who have sustained human rights violations. Lastly, the access to mental health services will not be sustainable without a system-level approach. We should work to change and challenge policies, integrate mental health within the health system and other systems in a country like education, as well as local community clinics to ensure sustainability. Advancing mental health and inclusive development needs to be done in tandem. Taking the inclusive development approach will result in fostering conditions that will help address mental health needs of marginalized groups, including victims of torture and conflict, ultimately resulting in healing trauma at the individual and the community level and promoting peaceful coexistence. Again, thank you so much for having me. Thank you so much for inviting me, and I'm excited to see that this forum exists for us to continue to elevate mental health.